If you've been plagued by knee pain like Stephanie and I, there is some hope in sight for you.
I like the words non-surgical.
Non-surgical.
Also, that's a good thing. Joining us today with the details is Lance Liberti, president and founder of Integrative Practice Solutions, here with maybe a solution to knee pain over the years. We were talking in commercial break. Both Michael and I have had problems with our knees for years. I've had mine reconstructed a couple times, scoped. He's had scoped, and this is how you kind of got into this whole business, right?
It is. I followed a similar path. I played high school football here locally at Countryside in Pinellas County, and my sophomore year I suffered a pretty serious knee injury to my right knee. I had multiple surgeries after the fact, and it helped me for a while, but after graduating from USF, I had some serious problems with my left knee and got an MRI, as most people do, and got some bad news. I had lost all the meniscal cartilage and most of the articular cartilage, which is the hard cartilage that surrounds the bones, in my left knee. And in my early 20s, I was told that knee replacement surgery was going to be my only option.
And that's huge. Like, you're so young.
And it was scary. I didn't like that that was my only option, and I didn't take it for an answer, and I started looking around. And I found a product called hyaluronic acid, which is a substance that's naturally occurring in all of our joints. It's in your fingers, your toes, but in largest quantity in your knee, the largest weight-bearing joint in the body. And this medication, this all-natural medication, actually was able to save my left knee. And I'm here today, over a decade later, not requiring surgery.
Any more surgeries? All right. So how did you discover it, and exactly how does it work?
Well, I discovered it actually, believe it or not, by complaining. I was feeling depressed about my diagnosis, and I was complaining to a friend of mine, a chiropractor, whose father was doing these injections. And he said, "Fly up, stay with me, and we'll try these in your knee." And in 5 short injections, it completely reversed all my injuries and my symptomology, and I got back to normal function. I could run, I could jump, I could do things I hadn't done since before my injury. And I convinced those 2 doctors to take a crazy chance and open a clinic with me. And that was my test kitchen, where I developed this non-surgical treatment model. And we combine injection therapy with knee bracing, which I've brought with me to unload the joint, so that during the injections it acts like a scaffolding and opens up the space between your tibia, your thigh bone, or your femur, your thigh bone, and your tibia, your shin bone, to unload that pressure as we refill the joint with this natural fluid. This natural fluid keeps that space present and reduces friction, so you're no longer wearing away your cartilage of your meniscus or your articular cartilage anymore. Gives the body a chance to regenerate that faster than you're breaking it down. So while there's no cure for osteoarthritis, there is a way to get ahead of the disease to a point where your body can rebuild its natural substances faster than you can break them down. And it's helping hundreds of thousands of patients around the country avoid total knee replacement surgery when they've been told that's their only option. I'm proud to have created a model now where we teach, train, and certify doctors around the country. And we now have over 70 providers in 25 states providing this procedure, including many right here in the Tampa Bay area.
Right. Now, why are doctors so interested in providing this treatment opposed to traditional methods like surgery?
Well, there's really 2 reasons. One of them is for helping the patient, and the other is for helping themselves. Doctors oftentimes are frustrated with the clinical outcomes. They use steroids, they use pain medications, they use anti-inflammatories. The patients don't get well. The side effects from those things sometimes even make them worse. And then the doctor, especially the primary care doctor or the pain management doctor, has no option but to send them for surgery. And when you go to the orthopedic surgeon, they've been empirically trained to use that scalpel, and that's typically the solution they're going to present. I found that there was a gap between that conservative care at the primary care level and the surgical intervention. And my goal was to put a treatment there that would bridge that gap and allow the patient one last chance to try a risk-free, non-surgical procedure covered by all insurance, including Medicare, to potentially avoid that risky and often painful knee surgery. The other reason is financial. Knee surgeries are very expensive.
They are.
Average
big
cost
time,
over
yes.
$32,000. Patients' copays can be $6,000 to $10,000 per knee. This procedure comes in at a mere fraction, about 1/20th the cost of knee surgery per knee. And it provides the primary care doctor and the pain management doctor a chance to make some revenue without